Top 4 morning habits to reduce the risk of prostate cancer. How do you know if you have prostate cancer? You may have a high PSA but not actually have cancer. Conversely, you might have a low PSA yet still be at high risk for developing prostate cancer. So how do you know what is accurate and what your lab results really mean? What are the treatment options and how can you reduce your risk of developing prostate cancer? Today, we will also reveal 4 morning habits to reduce the risk of prostate cancer your doctors never told you. If you are over 50, this could be the most important video of your life. So let's begin. Early prostate cancer is difficult to notice because it often grows quietly with no clear warning signs. Many men feel completely normal, which is why this disease is called silent. In the earliest stages, the tumor is usually small and confined within the prostate, so it does not press on the urethra or bladder. As a result, there is no pain, no burning, no blood, and no obvious urinary problem for most men. This absence of symptoms is exactly why relying on how you feel is dangerous. The body does not alert you until the cancer becomes larger or moves beyond the prostate. However, some early changes can appear, and understanding them can help you recognize when something is not right. One subtle sign is a weaker urine stream. You may notice that your stream takes longer to start, slows down sooner, or stops and starts instead of flowing smoothly. Another early clue is the need to urinate more often, especially at night. Many men wake once at night as they age, but a sudden change to 2 or 3 times a night can be a warning that the prostate is enlarging or becoming irritated. You might also feel that your bladder never empties fully, or that you need to rush urgently even when only a small amount comes out. These symptoms are not specific to cancer. They can occur with benign prostate enlargement, infection, inflammation, or age-related changes. Still, persistent urinary changes should never be ignored. Sometimes blood appears in the urine or semen, even in early stages. This bleeding can be very faint and appear only once. So many men brush it off. Any trace of blood from the urinary tract deserves attention because it signals irritation or tissue change that needs evaluation. Some men notice discomfort in the lower pelvis, the perineum, or the lower back. The sensation may be dull and vague rather than sharp or severe. Erectile changes can also occur. Difficulty achieving or maintaining an erection is not usually caused by early cancer, but when it appears along with urinary changes, it strengthens the case for getting checked. What makes early detection complex is that most of these symptoms are unreliable. Many men with early prostate cancer have none of them. Meanwhile, many men with these symptoms have benign conditions instead. The only way to know what is happening inside the prostate is through proper testing. Listening to your body helps, but testing protects you. Any man who is noticing changes, or any man over 45 with risk factors, should speak to his doctor. Early detection is the difference between simple treatment and dangerous delay. Now let's uncover the first-line tests and how to know whether they are normal or not. The first-line tests for prostate health are simple, fast, and highly informative, and understanding what their results mean can help you take control of your risk long before symptoms appear. The PSA blood test is the primary screening tool. PSA stands for prostate-specific antigen, a protein made by prostate tissue. When the prostate is inflamed, enlarged, or developing cancer, PSA levels often rise. A PSA result is usually measured in nanograms per milliliter. In general, a PSA below 4.0 is considered within the traditional normal range, though many doctors now use age-adjusted ranges because PSA tends to rise with age. A PSA under 2.5 for men in their 40s and 50s and under 3.5 for men in their 60s is often considered reassuring, but the number you start with matters as much as the number itself. A sudden increase from a previous PSA, even if still below 4.0, can signal a problem. For example, a rise from 1.0 to 2.5 within a year is more concerning than a stable PSA of 3.5 over several years. A rising trend is often more predictive of risk than the absolute value. The percentage of free PSA can also help interpret borderline results. A lower free PSA percentage suggests a higher risk of cancer. Alongside the PSA, the digital rectal exam remains essential. During this exam, the doctor gently feels the back surface of the prostate to detect firmness, asymmetry, or nodules. A normal prostate feels smooth and rubbery. A prostate that feels hard, irregular, or knobby may indicate cancer, whereas a uniformly enlarged but soft gland often reflects benign enlargement. Although many men find the exam uncomfortable, it lasts only seconds and can detect cancers that PSA alone may miss. When PSA or exam findings raise questions, the next first-line tests are imaging studies, usually ultrasound or MRI. A transrectal ultrasound can assess prostate size and detect suspicious areas. A normal ultrasound shows a smooth, symmetrical gland without obvious masses. MRI offers even clearer detail and can show areas with restricted blood flow or unusual cellular activity. A normal MRI displays a uniform prostate without dark or irregular zones, while a suspicious MRI highlights regions that may require biopsy. These imaging tests help avoid unnecessary biopsies by identifying which areas truly need sampling. If imaging suggests risk, a biopsy is performed to confirm what the cells look like under a microscope. A normal biopsy shows healthy prostate cells with no signs of abnormal growth. Only a biopsy can give the final answer about whether cancer is present. Knowing whether your first-line tests are normal depends on trends, context, and interpretation rather than a single number or image. A stable PSA, a smooth prostate exam, and normal imaging usually indicate low risk. Rising PSA values, abnormal prostate texture, or suspicious imaging suggest the need for further evaluation. The key is not guessing or waiting for symptoms. It is following the numbers, watching the trends, and letting each test guide the next step so you stay ahead of disease rather than reacting to it. Now let's talk about the treatment options if you are detected with prostate cancer or high PSA. When prostate cancer is detected, the treatment options depend on how deep the tumor has grown into the prostate, how long it has likely been present, how far it has spread beyond the gland, and how closely it must be followed afterward. When the cancer is very small and contained entirely within the prostate, many men can choose active surveillance. This approach avoids immediate treatment and focuses instead on monitoring. Doctors track PSA trends, repeat exams, perform MRI scans, and sometimes take follow-up biopsies. If the cancer stays stable, no intervention is needed. If it changes in size or aggressiveness, treatment begins. This option works best for low-grade tumors that grow slowly and pose little immediate risk. When the cancer is larger or shows signs of becoming more aggressive, but is still contained inside the prostate, treatment usually shifts to either surgery or radiation. Surgery involves removing the prostate completely, often with nerve-sparing techniques that reduce the impact on urinary control and sexual function. A successful surgery removes all visible cancer and offers excellent long-term cure rates when the disease has not spread. Radiation therapy is another option for men who want to avoid surgery or who are not good surgical candidates. External beam radiation focuses targeted energy from outside the body, while brachytherapy places tiny radioactive seeds directly into the prostate. Both approaches destroy cancer cells over weeks or months and can be combined with hormone therapy when the tumor is more aggressive. When the cancer extends beyond the capsule of the prostate or threatens the surrounding tissues, combination therapy becomes more important. Hormone therapy, also called androgen deprivation therapy, lowers testosterone levels because prostate cancer cells depend on testosterone to grow. Lowering these hormone levels often shrinks the cancer and slows its progression. Some men receive hormone therapy for several months before radiation to improve results, while others continue long-term therapy when the disease has spread farther. If cancer reaches the lymph nodes, bones, or distant organs, the treatment plan expands to include systemic therapies. These include advanced hormone treatments, chemotherapy, targeted drugs, and immunotherapy. These treatments work throughout the body to slow cancer growth, relieve symptoms, and extend survival. Many men live for years with advanced prostate cancer using modern combination therapies that were not available a decade ago. Regardless of the stage, follow-up is crucial. After surgery or radiation, doctors monitor PSA levels at regular intervals. A PSA that stays near zero after surgery or remains very low after radiation indicates good control. A rising PSA can show early recurrence even before symptoms appear. Follow-up schedules usually begin with visits every few months in the first year, then gradually spread out as stability is confirmed. For men on active surveillance, follow-up is more frequent, with PSA testing, imaging, and biopsy at planned intervals to ensure the cancer remains safe to observe. For men with advanced disease, ongoing monitoring guides adjustments in therapy. Treatment for prostate cancer is never one size fits all. Each option depends on stage, growth, spread, age, health, and long-term goals. The greatest advantage comes from early detection, which offers the widest range of effective choices and the highest chance of cure. Now let's talk about the 4 best morning habits to avoid prostate cancer from happening. Beginning each day with habits that protect the prostate can create long-term health advantages, especially for men over 50. One powerful morning habit is drinking enough water soon after waking. The prostate and urinary tract rely on steady hydration to reduce inflammation, flush toxins, and keep urine from becoming overly concentrated. When the bladder is dehydrated for long periods, irritation increases and inflammation becomes more likely, which may contribute to chronic prostate problems over time. Starting your morning with a full glass of water supports circulation, lowers urinary irritation, and helps the prostate function more efficiently throughout the day. Hydration also supports healthy blood flow, which is essential for hormone balance and normal prostate cell turnover. Another protective morning habit is including a prostate-friendly breakfast built around whole foods rather than processed options. Foods rich in antioxidants, such as berries, tomatoes, leafy greens, walnuts, and oats, help reduce oxidative stress that can damage prostate cells. Lycopene from tomatoes, flavonoids from berries, and fiber from whole grains all support lower cancer risk by reducing inflammation and moderating insulin levels. Men who eat diets high in processed meats, sugary pastries, and refined carbohydrates tend to develop more metabolic inflammation, which can increase prostate cancer risk. Starting the day with a nutrient-dense breakfast stabilizes blood sugar, supports healthy hormone metabolism, and provides the antioxidants needed to protect prostate tissue. Even small additions like a handful of berries or a spoon of ground flaxseed can make a measurable difference over time. A third morning habit that strongly protects prostate health is engaging in light to moderate physical activity soon after waking. Morning movement reduces inflammation, improves insulin sensitivity, and helps regulate body weight, all of which influence prostate cancer risk. Studies consistently show that men who maintain a healthy weight and exercise regularly have a significantly lower chance of developing aggressive prostate cancer. A morning walk, gentle stretching, cycling, or a short strength routine boosts circulation to the pelvic organs and reduces levels of harmful hormones linked to cancer development. Consistent movement in the morning also lowers stress hormones, and high stress over many years is associated with higher inflammation and poorer prostate outcomes. Even 10 or 15 minutes of movement can shift the entire hormonal environment of the day in a protective direction. A fourth habit worth adopting is taking a quiet moment to support hormone balance through mindful breathing or stress-reducing practices. Prostate cancer risk rises when chronic stress disrupts hormone regulation. Elevated cortisol levels can interfere with testosterone metabolism and promote inflammatory pathways that affect the prostate. A brief morning practice, such as diaphragmatic breathing, gratitude reflection, meditation, or even a peaceful cup of tea in silence, can lower baseline stress levels. When practiced daily, this protects hormone stability and reduces long-term inflammation. Many men overlook stress as a factor in cancer development, yet emotional load shows measurable effects on the immune system and cellular health. Beginning the day with calm rather than rushing allows the body to settle into a healthier rhythm that supports long-term prostate protection. These 4 habits work together to protect the prostate by lowering inflammation, improving metabolic stability, supporting balanced hormones, and reducing cellular stress. They require no medication, no equipment, and very little time. They reflect the growing body of research showing that daily lifestyle choices shape cancer risk far more than most men realize. Simple morning decisions accumulate across years, influencing whether prostate cells stay healthy or become vulnerable. Starting your day with hydration, a protective breakfast, consistent movement, and a brief period of calm forms a foundation of prostate-safe living that can make a meaningful difference over time.